Bicuspid aortic valve is a very common birth anomaly, the most common birth anomaly of the heart. It's present in about 1 in 50 people in the United States. It's probably actually more common than that. It can be a diagnostic challenge, but it's important because bicuspid aortic valve is associated with aortic valve blockage, which is called aortic valve stenosis, aortic valve leaking, and aortic aneurysm. So any patient born with a bicuspid aortic valve is probably likely to develop any of those three things at a rate of 30 to 50% throughout their lifetime. About 1 in 3 family members of somebody who has a bicuspid valve is going to have some form of this genetic problem. Interestingly, the genes of bicuspid aortic valve, even though it's the most common reason to have and probably an aneurysm, we don't really understand the genetics of bicuspid aortic valve very well. The aortic valve, which is the main valve that separates the squeezing chamber of the heart from the aorta, is supposed to have 3 leaflets. Those leaflets are kind of like the consistency of contact lenses in most people, but bicuspid valve patients have a genetic change. Something happened in their genetic recipe that made them either be born with 2 valve leaflets. That's actually a very uncommon form of bicuspid, hence the bi for 2 leaflets in bicuspid aortic valve. Most bicuspid valve patients are born with some degree of fusion of 2 of those 3 leaflets. Okay, and that partial fusion of those 3 leaflets makes 2 out of those 3 leaflets kind of seem like 1 leaflet. So these are basically some kind of functional bicuspid valve. The problem with these bicuspid valves is partly that all of them have some turbulence that interferes with the blood flowing across the valve, and that's part of why bicuspid valves are more prone to leak or get blocked up at some point in life. Why they're associated with aneurysm, that's a much harder question to answer, but it simply has to do with the same genetic reason why they had a fusion of those leaflets in the first place. Probably has something to do with why their aortic recipe was altered, and quite a number of people in the United States and around the world get aneurysms associated with bicuspid aortic valve.